In this week's episode, we're going to be discussing, are rates of colon cancer rising in younger patients? How and when can you get tested for colon cancer? And is there anything that you can do to decrease your risk? Hi everyone, and welcome back to the Chemist Couple podcast with Jess and Lee. We just want to say thank you to everyone who's subscribed recently to the channel. But if you're watching this and you haven't already subscribed, then please do. Also like the video and comment on it, as it really helps our channel and it helps us to create more content like this. Also, if there's anyone who you think would benefit from listening to this podcast or any of the podcasts that we've previously done, then please send it to them. As always, everything that we discuss in this podcast is for informational purposes only and should not be used in substitution for seeing a registered medical professional. So let's get into it. Why did we choose bowel cancer or colon cancer, as it's known in the US?
So the study that was released early in December in the Lancet just showed that there was an increase in risk and incidence in young adults. And given the fact that we are trying to speak to people of a similar age to us, it's just a good idea to maybe bring it to light and what to look out for.
Yeah, I think also, as with a lot of podcasts that we do, you have a family history of bowel cancer, don't you? So your nan unfortunately died at a fairly young age, to be fair.
66.
66, yeah, from bowel cancer. And with all of our podcasts and all of the science that we do look into, we try to implement it into our life. And so bowel cancer obviously is a trend in the media at the moment. I think, the Lancet recently published that report. I've seen it a lot in the media in the UK anyway, that, the rates are on the rise. And so I think obviously it is important for us as 30-year-olds to be looking at the science. But also with the family history, it was important for you on a personal level as well, wasn't it?
It is. And globally, bowel cancer or colon cancer, we're going to refer to it. Well, that's a good point to touch on actually. So colorectal cancer in the US normally, bowel cancer in the UK, we're going to try and call it colon cancer throughout. But if we do use these sort of phrases, they are all interchangeable in this podcast. But globally, it is the third most diagnosed and is the second leading cause of death in cancers globally. That was in 2022 anyway. It was give or take 900,000 deaths and I think 1.9 million cases that were newly diagnosed.
I think an important point as well, recently it's come about that in the US, it's actually the leading cause of cancer death in men under the age of 50. So clearly, it is on the rise and it is a real issue. And so I think it's important that we are discussing it today.
It is.
So I think I wanted to ask you a question first, and I wanted to ask you, if I'm 30, so I fall into the cohort of patients that potentially could be at an increased risk, should I be worried?
I think with any medical advice or condition, you should always keep your eye on it.
Yeah.
Necessarily, you're not going to be at an increased risk in comparison to someone over the age of 50, but the rates in those who are 25 to 49 are increasing.
Yeah.
Where, on the other hand, people over the age of 50, their rates are stabilising or plateauing. Yeah.
I think that's an important point to make, because before we actually did the podcast and when I was looking on, like I say, in the media and I was reading the reports on it, I was worried that sort of the amount of people actually being diagnosed with colon cancer in this cohort of patients was greater than those over the age of 50. And I think that it's important to get it out from the very beginning that that is not the case. So you are more likely to get colon cancer if you are over the age of 50. And I think you said, was it between the ages of 80 and 85 is the most prevalence of
give or take mid to late 80s, yeah. That's in the UK, by the way.
Yeah. However, the risk here is that the number of cases being diagnosed under 50 is increasing and is increasing year on year.
Yeah, and it's a thing that we bring up quite a lot in our podcast is the use of statistics and how you interpret them going forward. So like you said, reading it from the title, it looked as though we had a higher risk in comparison to someone of our mum and dad's age. But in reality, it's just that our rates are increasing. So to put these into context, the data that they used was over 10 years and the average annual percentage change, so how much it increased by every year. So in the UK, we experienced the highest increase during this period and it was 3.59%, which is a lot.
It is a lot, yeah.
Yeah, so every
single year it increased
on average. So that means some years it might have went up 10%, it might have declined by a few percent, but on average over that time frame, it's been a 3.59% increase in 25 to 49-year-olds, whereas those who were aged over 50, it's actually reduced by minus 0.72%. So it's negligible in terms of how it's decreasing, but it's not increasing like the younger age groups.
Yeah.
And we looked into, well, we're trying to think of what's led to that decrease in the older population. It could be greater screening, it could be greater awareness, and especially in the younger ages, why it's increasing could be due to the fact of many environmental factors, which we're going to go on to later on. But also, cancer is a disease that we associate with old age. We don't associate it with young people who are thriving in performance. And we always thought it's good to include the statistics for the US. So it's rising again, so it's give or take just over 2%, and the population over 50, it's reducing by 1.49%, it's reducing by. So their rates in the younger people are increasing, not as much as in the UK, especially England, but their rates over 50 are declining quicker. So
yeah, I think I also seen in a study that the actual rates between the ages of 20 and 29 is the most sharply rising. So I think that was about 2.5% compared to 30 to 39, which was about 1.7%. Don't quote me on that one, but it's around about those figures, which obviously, again, is a huge difference. And, you know, you expect younger patients to not be at more of an increased risk or the prevalence to be as high, but obviously it shows that there is something that we need to investigate more to see why this is happening.
Yeah, and I mean, the Lancet didn't really go into how and why the rates were increasing or decreasing, but it was just the idea that it was drawing attention to. There was an idea that high-income countries are the only ones experiencing these increases in a younger cohort, but the Lancet study included countries such as Uganda and other lower economic countries, and they also found an increase within the younger cohorts. However, one thing with most studies is that there are limitations. So these all went off cancer registrations and all the registers within each country. So the UK had a full database, so we were able to give national coverage.
I think that's probably to do with the fact that we have a National Health Service here, so it's easy to keep records, isn't it?
Yeah, and there was quite a few other countries. I think France were underreported, so 11%. The US is based on 9% of the population. Canada, 75%. So a lot of these countries, when we're extrapolating the data, it may not necessarily cover the rest of the population. Out of the 50 countries and territories used, 27 were from Europe. And like I said to you, Europe is not 27 out of 50 in terms of the population of the planet, is it?
I think also another point to make is that 27 out of the 50 showed this positive correlation. So it didn't actually say which countries it was, or it might have done, but I didn't read that far into the study. But again, it could have been 27 European countries. I don't think it was, but
it wasn't. It was South American as well, like Peru.
But yeah, so.
But that leads us on nicely into, we now know that the rates are rising within younger populations. How can we and when can we get tested?
So this is a bit of a difficult one really, because actually the cohort of patients that we're discussing in this podcast right now in the UK and the US anyway are not eligible for testing. So unless you've got a family history or like a strong family history of somebody developing colon cancer at a young age, or you have Lynch syndrome, which is a genetic variation that increases your risk of certain type of cancers, colon cancer being one of them. IBD, you have IBD, then you're not eligible for actual screening below the age of 54 in the UK. And
well, within England. The UK split up, which is weird, isn't it?
Yeah.
So I looked into it. So Wales is 50, Scotland 50, Northern Ireland 60, and then England 54.
So 54 in England or 45 in the US. Now, that's recently changed, hasn't it? So it used to be 50 within the US and now it is now 45, and that is because of these studies that have recently come out. So that's positive. You know, the health system obviously in the US is a lot different to ours. So I did read into it that I think you can either go for a colonoscopy, which would be second line in the UK, whereas in America, a lot of people tend to go for that first. It's more invasive. However, the actual results that you get are the better interpreted, or, you know, the more specific, because obviously it's a camera that you're using to image the bowel, whereas the other tests that we naturally get or usually get in the UK is a FIT test, which is like a stool sample, and so it tests for very minute levels of blood in the poo, which isn't very specific. Although obviously if you have a positive FIT test, it then leads to further investigation in the UK. Obviously a colonoscopy would be the gold standard. which is what a lot of people in America do go for.
Yeah, I mean, within the UK, once you reach them ages that we've stated before, 54 in England, 50 within Scotland and Wales, and 60 in Northern Ireland, you then get called up for national screening. You are then sent out a test every 2 years. Once you've surpassed the age of 74 within the UK as a whole, you can then call up and still get your monitoring after this date.
Yeah.
Within the US, I don't know whether you get complimentary national screening once you do reach the age of 45, or whether it's all dependent on your insurance as to whether you request a colonoscopy or request a fit test. I don't know.
Yeah.
But definitely look into it with local authorities if you are based within the US, and it is worth looking into because, as you are now aware, rates are increasing across both the countries that we've just mentioned. Yeah. In the UK, how do you do a fit test?
So it's just a stool sample that you would take. So you collect the stool sample. Usually they'll give you like a pan, you know, to put in the toilet so that it's easy to collect the sample. And then it just gets put into a tube. So, well, actually you take a sample of the stool, put it into a tube, you label it, and then it gets sent off, doesn't it? And then results usually come back within 2 weeks. You can actually get private fit tests, meaning that you can order them online. You did mention about the fact
I did mention this because, again, I went through a fit test, well, earlier on this year, by the time we're recording this, but it was from a private company, and because the National Health Service uses certain products that are regulated by the MHRA, CQC, we can't then use that within the NHS. Yeah. So they may be accurate, but in terms of diagnostic purposes and its pathway into NHS care, they're not used. You've got to go through your GP to get the actual test. Yeah. So I wouldn't be too disheartened if it come back with a positive or negative. I would go through the NHS pathways. Yeah. But yeah, so that's how you test for it. Basically, you do that, and then after 2 weeks, you'll get a result back, or within 2 weeks, it might say positive, negative, or further results or investigations are required.
Yeah, and then that's when, like I say, you would then usually go for a colonoscopy, which is the camera, and then that they can take biopsies, so they can, you know, delve deeper into, you know, the health of your bowel. Also, they'll look for things like polyps. So polyps are growths on your bowel, which potentially can then lead to cancers. So usually, if they do discover them, they'll do what is called a polypectomy, where they just remove them so that they then can't go on to form colon cancer. So the other sort of cohort of patients that could actually get tested would also be patients who had signs or symptoms of colon cancer. Yeah. So I think that leads us nicely onto, well, what are the signs and symptoms?
Yeah, so any blood within your stool, any pain within the abdomen or rectal area, then you've got bloating, you've got an abdominal mass, you have unexplained weight loss, you have lethargy or anemia. Again, all these symptoms are non-specific, could be related to multiple factors. Same way blood in your poo could be through stress, trauma, acute infection, could be due to IBD. So it's not to worry about these symptoms, but definitely go and get seen, especially within the UK. If you are seen by a GP, you will be more than likely put on something called a 2-week pathway, which looks really severe, and it'll say cancer pathway. But the idea is we just need to get that patient tested within that frame to make sure nothing sinister is going on. Yeah. But like we said before, the national screening applies to the ages above that. If you are younger, so for example, me, I don't know, how would you go about it? Unless you had the symptoms, you wouldn't really get tested, would you?
You wouldn't, no. And unfortunately, with these cancers, with colon cancer especially, because of the pathology of it, it's usually in the later stages that it is detected, because of you don't really tend to get symptoms until the later stages. So yeah, it's a hard one, isn't it? So really the biggest thing, and we will go on to this now, is how can you reduce your risk? So that's probably going to be the best thing for people in our cohort, to try and just reduce the risk. Obviously, like we said, you can get fit tests over the internet, but they're very non-specific. And so if you had blood in your poo, like you've just mentioned, which is what it's tested for, it can be a plethora of things. And, you know, even if you had it, would the NHS then send you for further testing? We don't know. But yeah, so maybe the best thing would be to reduce your risk.
Yeah, there is a study that I will leave below, because I only looked at really the box plots for each of the scenarios, but there was obesity, smoking, you had diet, physical inactivity, and they were the main categories. So if you go into diet, for example, processed foods, they led to a positive correlation between developing definitely late onset colon cancer. Early onset, there was a link between it, whereas fruit, fibre, vegetables, they all decreased or had a lower incidence.
Yeah.
And there was a significant sort of result reported for each one of them.
Yeah.
And that was the trend with a lot of things. All the things that we sort of have advocated for throughout the previous podcasts. So reducing physical inactivity, reducing obesity, increasing the amount of fibre, microbiome, etc. All of them do have a positive effect within reducing your rate of colon cancer.
Yeah.
I believe the studies out there, you can read them yourself as well. I don't think there's too much evidence out there at the moment. Again, too many confounding factors.
Yeah.
And when you look at the rates of colon cancer that are rising, you can't categorically say that they are rising because of certain things, because of the incomplete data.
I think that's a good point.
But you look into the microbiome, that's your area of sort of interest, and you looked into it a bit more. And I know you didn't want to go into the pathology too much because it did go really complex, and we didn't have enough time basically to go through it, if we're being honest. But there was a possible link between the bacteria that was found within patients who had colon cancer or certain disease pathologies and those who didn't. And it was suggesting that, well, this is what you sort of explained to me, is that if you increase the diversity of your microbiome, it then stops the ability of all these sort of...
The more favourable bacteria in cancers to grow.
Yeah.
Yeah, so there's 3 specific ones. I won't go into what they're called. But yeah, so there's 3 specific bacteria that were found actually worldwide when they tested colon cancer tumours in patients. And so the thinking behind it is that in patients with a less diverse gut microbiome, it allows these certain bacteria to flourish. Obviously, it's all survival of the fittest. If there's less resources for bacteria, if there's more bacteria and more species of bacteria, then it doesn't allow these certain bacteria to grow and flourish. And so that was the thinking behind it. Again, as with everything, it needs more research putting into it because the evidence wasn't completely compelling. But I think from the studies that I have looked at, the more diverse your gut microbiome, the better your overall health, because we know that the gut microbiome is involved in everything. It's involved in immune response. It produces metabolites for certain reactions within the body. And so, yeah, increasing your fibre intake is going to feed your gut microbiome, and then it's going to hopefully allow it to be more diverse.
Yeah.
Yeah.
I mean, we do base a lot of our sort of practice on scientific studies, but if you look at this logically, in terms of bowel cancer, colon cancer, it is the colon.
Yeah.
So if you do certain things to impact its health, so antibiotic use, you are reducing the microbiome, you are potentially acting within a local vicinity anyway, then you've got your diet, you've got to absorb nutrients and water through your colon anyway. So if you're changing these to better sources, so non-processed, reducing your antibiotic use, increasing the fasting period, for example, so that food's not constantly bombarding it. They're all logical ideas and sort of solutions to reducing your risk anyway. Yeah. And you're not going to not benefit from doing physical activity, having a non-processed diet, not using antibiotics.
Yeah, maintaining a normal BMI, which I think I read a study where it said every 5 unit increase in BMI for women at the age of 18 increase your risk of developing colon cancer by 20%. Which is a huge risk. And, so reducing your BMI by 5 points could potentially reduce your risk by 20% of developing colon cancer. So, and I think, again, it's about this area under the curve. So it's about maintaining a healthy weight over a prolonged period. Do you know what I mean? So trying to maintain a healthy weight over your whole lifespan.
That's the biggest thing in health and medicine, is that you don't want just a snapshot of it being really good. Because for one day, that's not going to serve you any good as you're going forward. You want to be doing it for a consistent amount of time to reduce any risk. And a lot of these, well, in terms of my nan, for example, they believe that she could have been diagnosed 10 years prior. She did go for the previous test at the time, which was a fecal occult blood test. I believe it was more subjective, so you done the sample in a similar way, but it led to a colour change.
Right, okay.
Don't quote me. I think that's how it was. And then in 2019 in the UK anyway, we went to the FIT test, which then used a quantitative method where you got a physical value. Yeah. And that's when we started building thresholds, and it gave us a better accuracy and less false positives and less false negatives. Yeah. But going forward, I think you just need to be wary of anything. At the moment, our Western diet has been linked to a lot of non-communicable diseases, and they're definitely on the increase. Is it because we're better at reporting them? Is it because we're better at diagnosing them, potentially? But also I do think there is a correlation between what's happening with the modern life.
I think if you look as well at the trend as to when this has started to increase and the obesity rates, they sort of correlate with each other.
Yeah.
And then obviously if we look back at obesity rates, then it correlates with this introduction of ultra-processed food. Like, you know, I think Chile is a very good example of this, so that they were, within this Lancet study, they're one of the fastest growing incidences of colorectal cancer in the young. And I think it was in the mid-1990s, the obesity rate in children was 6 to 7%. You fast forward to the 21st century and it increased to 22 to 33%. And it directly correlates with the introduction of ultra-processed foods into their diet. You know, so it all sort of correlates with each other, you know, and like you said before, our diet, the Western diet, it's correlated with so many different long-term health conditions. So I think we do need to look at that and take that into account. You know, and all of the things that we do sort of promote on this podcast, where we say, you know, eat a whole food diet, include more whole grains, include more fibre, you know, make sure you stay hydrated, exercise daily. They're all positive for your health anyway. So even if it's not positive directly for colon cancer, because at the moment we don't have the studies to, will we ever? I don't know if we'll ever have the studies to fully back it up. But you know, it's going to be beneficial. It has to be.
Yeah, you know? I don't think we'll ever have the studies in a lot of areas to categorically say this is what has caused this.
Yeah.
Because there's too many factors to control nowadays, and with ethics and other principles in, I don't think that'll happen. But like we spoke before we actually started the podcast, in terms of a lot of the things that we advocate for and recommend forms the backbone of a lot of health inequalities. And there was a comment made, I think, on one of our videos the other day about we may take for granted what we do. And I don't think we take for granted, but we are definitely aware that it is easier for us, definitely in the UK and England, to sort of apply these general health principles. And for those who aren't and who have to resort to ultra-processed foods, needs must, and it is, and it's balancing that risk anyway. And if there are people who have to do that, maybe mitigate your risk by exercising more and
reducing alcohol consumption, or, you know, smoking cessation. But that is a good point, and the point that was made in the Lancet, and the reason why this was published, was because the recommendations that come out of it was that governments need to look at the social structure of like the food industry, and they need to make it better. You know, we know that a lot of diseases are linked to all of the processing of food and the food inequality, really. And so the governments really need to stand up and actually look at it and say, well, you know, colon cancer is just the tip of the iceberg. There's so many more diseases that this is associated with. We need to do something about it. And I completely understand and I sympathise with people, and it makes me so sad and so angry that the governments are allowing this to happen. You know, I say this all the time, that in this country, in the UK, in the 21st century, there are people using food banks. What food can you actually take from a food bank? It's all foods that are ultra-processed, that have a long shelf life, that are not fresh foods. And so the most vulnerable people in our society are the ones who get fed the food that's, you know, detrimental to your health.
It's a downward spiral.
Yeah, and
They've got less access to certain things, so we give them the things that are causing disease.
Yeah. The only thing that we can do is obviously bring it to everybody's attention and hope that, you know, in the future the government will do something about it. I know that actually in the UK, Professor Tim Spector, someone I always go on about, did speak in Parliament a couple of months ago, where he basically proposed what we should be doing going forward. And I think they actually do it I think it's in Brazil, is it, in South America, where he's advocated for warning labels on these foods, so saying what are the effects of having of this ultra-processed food. I think another one was sort of phasing out ultra-processed foods. Obviously that is a big deal. We did do it with the tobacco industry. You know, it may be a lot harder with the food industry.
It's going to be a lot harder for this, because, you know, food is a need, isn't it?
Yeah.
Smoking isn't.
Yeah, but can we do it? You know,
unless it's economically viable to people who are higher up, I don't think it'll ever happen. It's a business. The world is a business.
Yeah.
And until you make it financially appealing to someone, it's not going to work.
I think the only thing though that we can do is sort of, well, I mean, we do it anyways, like not buy the food. And then I think it needs to go back to sort of communities getting together and doing a vegetable patch, or, you know, and really gaining that community spirit back, which we don't have anymore, especially, you know, where we live in the UK. And then, you know, you're creating less demand for all this food, and so then the government has to stand up and do something. I know that that's really
it's
just
a far
like,
way off, but
you
it's
know,
got to start
off,
somewhere,
but
hasn't
it does have to start somewhere. And I think, again, you know, bringing it to everybody's attention that, you know, the detrimental effect that this food can have, and just reducing it where possible, you know.
It's a good start. But to summarise this video, the rates in those who are 25 to 49 have shown to be increasing, especially within England. It's got the steepest increase out of the countries that were tested. Other countries have given data, for example, the US, but it's only 9% of the population. Interpret them how you will. It's probably from places like New York, Washington, LA, etc. In terms of who can get tested, look at your local guidelines. In America, on average, it's 45 and above. I don't know how you go about getting national screening over there. In the UK, depending on which country you're in England, it's 54. Wales and Scotland are 50. Northern Ireland, 60 for some reason. All of them have the upper limit of 74. If you don't fall within them age categories, you may have a higher risk. For example, if you've got inflammatory bowel disease, you may have Lynch syndrome, you may have a strong family history, or you may just have the signs and symptoms which we've just said, which are blood in your stools and a mass within your abdomen. You may have unexplained weight loss, lethargy, anemia. You could have altered bowel habits, and these should not be ignored. You should always go and get these seen to. They may have other causes. They may be due to stress, a change in diet, but you shouldn't, hemorrhoids, because they'll cause blood, acute infection, but you shouldn't ignore them. You should always get them checked out, and you may get put onto a 2-week pathway. Do not be scared, because like we said, the chances are it's going to be something else, but peace of mind is a lot better. And if it is colon cancer, in a very few cases, you've caught it early enough, hopefully, to get treatment. Treatment is completely advanced now since, 19, 20 years ago from when my nan first had it. So I definitely would go and get it treated. And the best way to prevent any disease is by addressing your lifestyle. So have a whole food diet if you've got access to it. Exercise, again, if you are able to exercise. And that doesn't mean going to the gym. It means walking, mobility exercises, whatever that may be. Being active in general. Reduce the smoking if you do smoke. Reduce alcohol consumption. Try and reduce your stress if you are able to. I'm poor at that one. I think we're both poor at that one, to be honest.
Maintain a healthy BMI. So not being overweight or obese, which again, it's not just linked to colon cancer, it's linked to many other different types of cancers and also many other different diseases.
And it isn't something, and cancer is not a disease of just the old. Yes, the peak prevalence within the UK is 85, give or take, but that doesn't mean someone who's 24 can go and get bowel cancer or colon cancer. So that was the biggest point we wanted to say, that young people are increasing in rate. They haven't got an overall majority over those who are 50 plus, but we don't want it to level out. Hopefully we want them both to come down drastically, but we don't want them definitely leveling out. That's a big thing. But if you've got to this point of the video and you haven't liked or subscribed on whatever platform it is, please do so. It does help us look into a bit more studies. We have put a poll out as well on YouTube to see what other people would like us to do for our next video. And if anyone's got any suggestions, we're always open to them. Any questions you want directly answering. Is there anything you'd like to say?
No, just thank you for listening.
Thanks for listening, and we'll see you next week.